Welcome to my life. You should go for check-up during the glaucoma week. We're in the glaucoma week, and what is a glaucoma? It is an eye disease that damages the optic nerve. It's an eye disease that damages the optic nerve. So it is very important to go for check-up this week. And the glaucoma week, when is the glaucoma? The glaucoma week is from the welcome to my life. Welcome. Thank you for coming. Thank you. Like, subscribe, and share. Thank you. So when is the glaucoma week? From the 8th of March till the 14th of March. Take it as an advantage to go to any eye clinic of your choice and consult. Consult is glaucoma. And what is glaucoma? It is a type of disease that affects the eye and damages the nerve that supplies the eye. During this week, okay? So because glaucoma is a progressive, irreversible eye disease that often shows no early symptoms until significant permanent vision loss has occurred. Like when you go to developed countries, Elizabeth, make it welcome. Thank you for the sticker. Thank you, Elizabeth. Thank you. When you go to hospitals, maybe big hospitals in big towns, they have machines which can easily dictate this glaucoma when it's this small. What we do in our own locality is we check the eyes early. We check the eyes early, and there are certain things we will do with the eyes that will help dictate if you are having glaucoma or not. So there is a nickname that has been given to to glaucoma as a silent thief of sight. Glaucoma is a silent thief. It means that you can stay with glaucoma and it will steal your sight, you will not know. So it's the leading cause of preventable blindness. When we talk of preventable blindness, it's something you can prevent. For example, you say, this thing, I can prevent this thing. And how can you prevent the blindness? We say it's some sort of preventable blindness. How can you prevent it? By making regular, proactive, and early dictation only way to save your vision. Go for checkup. You might be saying that there is no glaucoma, meanwhile you have glaucoma. It's a silent thief. Glaucoma is a silent thief. There is no early sign to show that, oh, I had this sign to show glaucoma. In most common form, open angle glaucoma develops slowly and painless. You know, if for those who have not done ophthalmology, there is a system in your eye like a stream that is flowing, like a river that is flowing. When you block that river, when you block the path of that river, it will start doing what? Start trying to take other paths. There is a fluid in the eye, a type of fluid in the eye, water in the eye, they call it aqueous. It's being produced and then it's circulating in the eye. When it's produced, it circulates in the eye. It's like a stream. It's like a river that is circulating. You know, when you block a river, it must look for another path. And so when you block, when the aqueous, the path that the aqueous is taking is blocked, means there is a problem. There is a path that the aqueous passes to leave the eye. They call it the anterior chamber angle. It passes through the anterior chamber angle to leave and go into the system. Sometimes that angle is open and this fluid drains and goes to a place where it's called the trabecular meshwork. It can be blocked at the trabecular meshwork. This trabecular meshwork is like this sieve which we use in sifting fufu. We can use the sieve is sifting fufu. We can use it to sieve. We can use it to sieve tea. You know, when the sieve is blocked, those of you who have ever washed pap, when you are washing your pap, sometimes it blocks the sieve. That's how the trabecular meshwork is. Sometimes this aqueous is blocked, at the trabecular meshwork. And when it is blocked at the trabecular meshwork, welcome to my life, welcome. Subscribe, share for other people to come. Hello, where are you watching me from? I'm trying to teach people glaucoma locally. I make sure I don't use very big terms. I just try to explain it to the local people, to the patients, to those of you who might be having glaucoma. That's how I'm trying to explain it. I'm not teaching ophthalmologists. I'm teaching the local people. I want you people to understand what this glaucoma is. This glaucoma, sometimes, as I was talking, it is not even the angle in your eye that is blocked. It is somewhere, it is a place that is like a sieve. They call it the trabecular meshwork. It can be blocked. And when it's blocked around there, you feel normal. Your eye will be normal. The fluid will be draining and going out, but it will be accumulating and causing pressure in your eye. That is why glaucoma is called a silent thief of sight. Imagine that something steals your sight. If something steals your sight, close your eyes. If you are watching me, close your eyes for 1 second and you open it again. That's how glaucoma is going to steal. Do this. Open your eyes again. That's how glaucoma is going to steal your sight. Irreversible, but manageable. So in most common form, open angle develops slowly and penetrates, stealing peripheral vision first without you noticing it. So when you see it, when we talk of peripheral vision, they say it steals peripheral vision first. When you see, you keep your hands like this, and you check to see if you can see your hands. If you cannot see your hands, no, there is a problem with your peripheral vision. Means you are looking forward like this. You're looking as I'm looking there, and there is, if I don't see my hands, means there is a problem. You try this. Try this. Try this. If you don't see your hands, you know that there is a problem. You rush to a hospital. That's what they are saying. They say it is painless. 40% of your vision might already be gone. It is irreversible, but manageable. It is irreversible. It means that the stage where you meet somebody's glaucoma is where you continue. Normally in life, we see 100%. You're supposed to see 100%. You might meet glaucoma patient with already 90%. Still sick with 90%. You continue from there, maintaining that 90%. You might meet patients with 50%. You continue from there, maintaining the 50%. You maintain that 50%. Welcome to my life. Please subscribe, share, and share for others to come and listen. I'm here. I'm trying to explain glaucoma to the local person. So what I was saying is that when some people come to the hospital, you can discover that they already have 50% of their eyesight gone. And you, as an eye doctor or an eye nurse, you are only there to maintain the remaining percentage. It means glaucoma is irreversible. You cannot take the glaucoma back. You cannot take the eyesight back. If somebody is already seeing 40%, it will remain there. You are only preventing the 40% not to go down to 30%. But you cannot let the 40% go up to 50%. That's what I'm saying. So they say it's but manageable. While vision loss to glaucoma cannot be recovered, early detection allows for treatment. When you detect it earlier, the percentage in which you meet the patient, you can give eye drops, you can give laser, you can do laser treatment. And the laser we have in our clinic is a cyclophoto coagulator, or you do surgery to lower the eye pressure and significantly slow or halt further damage. That's why I'm saying that you can do EV surgery on the eye. You can use eye drops. So where I'm working, we mostly use eye drops. And then, we use eye drops. We use laser. That's cyclophoto coagulator. Or we can do surgery. There's things that we can use. So higher risk groups need vigilance. Which are the higher risk groups? If you are 40 years of age, you are at risk. From the age of 40, you are at risk. Check your eyes. Check your eyes even once in a while. Check your eyes to see if you have glaucoma. If you are having a family history of glaucoma, check your eyes. What do I mean by family history? Sometimes your grandmother or your grandfather had glaucoma. Sometimes when you sit, if you did not see your grandfather or your grandmother, ask, was my grandmother seeing well? If they say your grandmother was not seeing well, go to the hospital. Sometimes they say your grandmother or your grandfather was blind. Even though it's not only glaucoma that causes blindness, but when you hear that your grandfather got blind or your grandmother got blind, go to the hospital and check your eyes if you have a family member. And another thing is, if you are of an African, Caribbean, or Asian descent, go and check. Or you have diabetes, go and check. Your risk is much higher, often requiring screening. So if you have people with diabetes in your family, you are an African like me, maybe you have people who are blind in your family, go and check your eyes. Go and check your eyes during this glaucoma week. Even if you are working in an eye hospital, go and check your eyes. Do some checks during this week. Okay. During this glaucoma week, most eye hospitals offers free screening. Yes, they offer free screening. Go there and check your eyes. Even if you are a worker in the hospital, check your eyes. So during this week, eye hospitals they organize free screenings, and then people like me, Cataract Surgeon Heidi, I organize live talks like what I'm doing in order for you to be aware. Don't say I did not tell you that you should go and check your eyes. Don't say I did not tell you. What is the theme of glaucoma this 2026? The theme of glaucoma this 2026 is uniting for a glaucoma free world. The theme is uniting for a glaucoma free world. This year's focus emphasizes collective action in preventing blindness. It emphasizes what collective action in preventing blindness. Taking steps to get tested contributes to the global effort to combat this disease. So, 2026 theme for glaucoma is uniting for glaucoma free world. Uniting for a glaucoma free world. So keep it in you that is our theme for this year. Uniting for a glaucoma free world. If you are over 40, if you know your age, you are above 40, or if it has been more than 2 years since you last did eye examination, you are above 40, maybe your 40th birthday just arrived, than to start buying drinks for people and making happy birthday to you, pay your transport and go to the hospital and check your eyes. If you are 40, I don't know why you are even celebrating birthday. Pay your transport, go to the hospital and check your eyes. Okay. Even if you have once checked your eyes the last 2 years, go now and check your eyes. What is the theme for the year? Uniting for a glaucoma free world. Write it down if you are listening to me. Uniting for a glaucoma free world. And why? Who are those who are supposed to go and check their eyes? When you are 40 and above. And I repeat, live happy day to you that you are buying things for people. Pay, keep that money, go to the hospital and check yourself. There is one thing people don't know. When you are already 40 and above, than to celebrate birthdays, go and check your system. Keep that money, go and check your system. Than to be celebrating birthdays and doing funny things in your life. Keep the money, go and check your system. I'm shocked to see people at 40 still celebrating birthdays. And maybe you were at the age of 38, you lastly check your eyes and you said they were all good. Go now at the age of 40 and check your eyes. And those of you who are already 50, oh, why should you go for check-up during this glaucoma week? During World Glaucoma Week, from the month, check-up is essential because glaucoma is what? It's a thief of sight. Go and check your eyes this week. Who should prioritize a checkup? I repeat, who are those who prioritize a checkup? You are over the age of 40 or 60. If you are above 40, let's leave 60. If you are above 40, thank God that you are 40, go and check your eyes. Don't wait until you're 60. There is a family history of glaucoma. Go and check your eyes. Okay. If you have medical conditions like diabetes, high blood pressure, or extreme nearsightedness, or you are short-sighted, you have hypertension, welcome, 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 welcome. Okay, thank you. So if you are short-sighted, or you have hypertension, or you have diabetes in people in your family, go and check your eyes during this glaucoma week. Now, if you are on corticosteroids medications, what are corticosteroids? There's some type of drugs that people take. We call dexamethasone. If you have ever heard of dexamethasone, you have ever heard of prednisolone. If you are on this type of treatment, if you are taking this type of drugs, go and check your eyes for glaucoma. Go for glaucoma screening. Okay. So when you go for glaucoma, some of you, when we say go for glaucoma screening, you start imagining, what are they going to be doing on my eye? Yes, you must imagine. There is what we call a tonometer. Tonometry is measuring the pressure of your eye. According to WHO, now the normal eye pressure is 8 to 16, but some people still consider 10 to 20 as normal. There are other things to consider, but if you are not an eye doctor or an eye nurse, which I know I'm teaching patients, I'm not teaching eye doctors and eye nurses, I'm teaching patients. If you, as a patient, you go to the hospital, always ask the doctor, what is my eye pressure? If your eye pressure is above 20, okay, this is Lizzie. Kwake Lizzie. Hello, Lizzie, welcome. Welcome to my life. Kwakara Lizzie. Lizzie, welcome. Thank you. Thank you for joining my life. So, as I was saying, some people, when they say they should go to the eye hospitals for eye examinations during glaucoma week, they start doubting, what are they going to do with my eyes? The first thing is, when you reach, they'll do what is called tonometry. Thank you, Lizzie. Lizzie, thank you very much. They will do what we call tonometry. That's taking your eye pressure. When they take your eye pressure, that's when they will decide to give you treatment or not. Another thing they're going to do is to do optic nerve examination. How do they examine your optic nerve? They examine your optic nerve using an instrument called an ophthalmoscope. They process fundoscopy. They use that instrument to check the back part of your eye, because your optic nerve head, the nerve that supplies your eye is called optic nerve. The optic nerve head is at the back part of your eye. So what they will do is they will use that ophthalmoscope to check how your optic nerve is. And they will tell you if it is already damaged or it is still okay. That's what it. Another one is they will check your visual field. As I said, when you keep your hands like this, that's what we call your peripheral vision. All like this. So you must check your peripheral vision. All like this. You keep your hands like this. It's your peripheral vision. So if you are not able, when you sit like this, you are not able. As I'm talking to you, I should see the people passing here, and I should see the people passing here. If you cannot see it, no, there is a problem. When you do it, you have already done your visual field. But in the hospitals, they have some machines which are more accurate. Okay. Would you like to find a local hospital for your treatment? Yes. Find a local hospital. And I'll repeat, if you are an eye nurse, if you are an eye nurse, go and check your eyes during this week. Okay. So what is the glaucoma week? The glaucoma week is from the 8th to the 14th. So I will repeat, glaucoma is a silent thief of the eye. Glaucoma is a silent thief of sight. Why are we saying so? Because there are no early symptoms. People with chronic glaucoma, the most common form, they have no pain, there is no redness, you have normal eyes. If you have early glaucoma, you have your normal eyes. The next thing is there is hidden damage. It means that, what does that mean? It means you can lose up to 40% of your, you 40% of your vision without noticing it. I've had patients, let me tell you a story. I've had patients who have come to the hospital and they've never covered one eye to look with the other eye. They only come to the hospital and we discover that they are already blind on one eye, completely blind on one eye, and the other eye is only remaining about 20%. So go for it. That's why we call it hidden damage. And then now we say asymptomatic means it has no symptoms. You cannot notice it. And then early dictation saves sight. That's why you are supposed to go for your screening during this week. Welcome to my life. Welcome. Please subscribe, share, let people know I'm on. Subscribe and share, let people know Nkulu is on. Cataract Surgeon Heidi is on. They say early dictation saves sight. It means when you go to the hospital during this period. This is glaucoma week. Welcome, welcome. This is glaucoma week from the 8th of March to the 14th of March. Go to any hospital, any eye hospital, not just any hospital. Go to any eye hospital and do routine checkup. Go and check your eyes. Just go and check your eyes. Because glaucoma is a silent thief of sight. When you are already working in an eye hospital, check your eyes this week. Okay. Now, if they detect fast that you have glaucoma, that is when they can manage it. It can be managed when it is early detected. And how can we manage it? We can manage it with eye drops. They can start giving you eye drops. They can do laser. Like in my clinic, we have a cyclophoto coagulator which we use as our own laser. And then you have surgery. They can also do surgery. As I'm saying, I'm not teaching eye doctors, I'm teaching patients. So they can also operate your eye when you have glaucoma. Okay. Sometimes in developed countries, they can use a machine they call OCT in developed world. But we in the local places, we don't have OCT machines. We don't have those big machines. So we use our simple machines. So glaucoma is avoidable blindness. Studies show that 90% of blindness caused by glaucoma could be prevented. 90%. I'm telling you, there are people on the road who are blind from glaucoma. If they went to the hospital earlier for early detection, it would have been good. But they did not go. Well, there was no awareness. That is why this glaucoma week, while pastors are in church preaching on how to pray, we are here preaching on glaucoma. This is the week. This is the World Glaucoma Week. We are preaching on glaucoma this week. Singing, go and check your eyes. Whether the eyes are red, whether the eyes are hot, go and check your eyes. What are the things that we have to focus on during this glaucoma week? What are the things we have to focus on during this glaucoma week? We have to increase access to screening. During this week, many eye care professionals and hospitals offer free, accessible, specialized screening. They offer free, accessible, specialized screenings. Nearly all eye hospitals in my country are offering free screening. Free. So that you go there and check your eyes. Free. Go and sit and check your eyes. It's very important. Now, I will highlight the risk, the people who are at risk. I will highlight the people, welcome. I will highlight the people who are at risk. Who are those at risk? Each. Adults over 40 years. Those who are at risk. Adults over 40 years should go and check their eyes. If you are over 40, we don't need to beg you. Go and check your eyes. If you are over 40, don't celebrate birthday. Go and check your eyes. Leave these birthday things to these young ones. Family history. If a close relative has it, you are 4 to 10 times more likely to develop. Family history. There are people whose grandfathers or grandmothers went blind because of glaucoma. How will you know that your grandfather or your grandmother was blind? Ask. If they say your grandfather or your grandmother was blind, it must not be glaucoma, but just consider it 50% as glaucoma. And you rush to the hospital to check your eyes. This week is glaucoma week from the 8th to the 14th of March. Nearly all eye hospitals are offering free screening. Ethnicity means if you are in this group, you are an African like me. If you're a Caribbean or you are an Asian of origin, go and check your eyes. Okay. And now there are conditions. There are other conditions like if you are diabetic, you are hypertensive, Go and check your eyes. Why is glaucoma awareness important? The main purpose is to promote awareness about glaucoma. There will be many discussions, including covering up topics such as glaucoma affects vision. It is very important to do glaucoma awareness. How often should glaucoma patients have checkup? Glaucoma patients, how often should you see a doctor? In some hospitals, they give 2 weeks. In some hospitals, it's 1 month. Like with us, we give in my hospital, we give 1 month. Every month, you are coming for checkup. As an early diagnosed person with glaucoma, you may need to have your exam pressure checked every month in my hospital. If you are coming back to my hospital, you know that it's every month until you are a special case. If they give you 1 week, 2 weeks, you are a special case. But normally, if you are on our normal eye drops and the eye drops are helping you, we'll say 1 month. And if you are from far, we can give you 2 months. We can give you eye drops for 2 months. If it is already under control, we can give you eye drops for 2 months. What are some of the signs to show that what are the signs that glaucoma is getting worse? Some of the signs are you see halos around lights. When we talk of halos, when you carry water, you can start seeing halos around light, or you see rainbow colors. What are rainbow? When you carry water in, when you put water in your mouth, and you will see rainbows. That's what they are saying. When you put water in your mouth, in the sun, when you stand in the sun, you do, and you see rainbows. That's why you will start seeing without doing that. When you start seeing it, go for your eyesight. So sometimes you see blood vision that comes and goes. No, there is a problem. You have problem glaucoma. What is the rule of 5 for glaucoma? There's the rule of 5 for a simple rule for detecting retinal. No, that one is for doctors and nurses. What habits worsen glaucoma? Harmful habits like smoking. Harmful habits like smoking and excessive alcohol. When you are taking alcohol, you know that they can worsen glaucoma. And then, because these habits, they increase eye pressure, damaging the optic nerve, worsening vision loss. Unhealthy lifestyle such as poor diet, lack of exercise can also make glaucoma symptoms worse. If you are a smoker, you have poor diet, you are a drunkard, no, those things can make glaucoma to go worse. So, what is the nickname for glaucoma? What's the nickname for glaucoma? The silent thief of sight. The nickname for glaucoma is, welcome to my life. The nickname for glaucoma is the silent thief of sight. That is the nickname of glaucoma. How do you prevent glaucoma from worsening? How do you prevent glaucoma from worsening? They say eat a healthy diet, exercise, Limit things like caffeine. This caffeine, coffee, that we are drinking, limit it. If you know you are taking it, and then always drink a lot of water, and then prescribe drugs. What percentage of glaucoma patients lose their vision completely if left untreated? According to 28% of patients diagnosed with glaucoma between 1965 and 1980, the number fell to 13.5% for patients diagnosed with glaucoma in the year 2000. If left untreated, glaucoma reduces peripheral and eventually causes damage. Therefore, now the thing is better now because people are more aware of glaucoma now than in the 80s, 1980s, in the 19th. People are more aware of glaucoma now. So go and check your eyes. Don't disgrace yourself with blindness. Uh, can too much screen time uh, 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 destroy glaucoma? Too much screen time you are on computer screen, or can it cause glaucoma to become worse? No. So don't go and sit and say I was working on computer for long and my eyes. For how long does glaucoma take to destroy an eye? If left untreated, it takes about 15 years to destroy an eye completely. It means if you have glaucoma at this age of 40, by the age of 65, they'll be holding your hand. If you don't want, if you don't go and at the age of 55, not so. If your eye pressure is high and it is a thief of sight, you don't go to. Let me fix my cap. You don't go to fix it. No, you're in trouble. What are the red flags of glaucoma? They say eye pain or pressure, a dull ache or intense pressure may signal acute glaucoma. Persistent redness, especially with other symptoms, requires is a red flag for glaucoma, but I'm not talking about the red flag issue. What are you not supposed to do if you have glaucoma? There are specific activities that living should be cautious of. You must avoid this downwards position, always keeping your head down, like these people who are doing some top prayers. I will not talk. It can increase your eye pressure. So can you live with glaucoma without going blind? Yes, you can. You can live with glaucoma without going blind if you check your eyes and you are on eye drops. There are people who have lived with glaucoma till good old age. They don't die because they are controlling it. So if there's good follow up, like in my clinic, we always tell the patients to come every month. But if you have your eye pressure is resisting, sometimes we give you eye drops and we can give you every week, sometimes every 3 weeks, sometimes every 2 3 weeks, but we mostly give every month. And sometimes we've seen that the patient is far, from a far distance. We give you 2 months, but we give you the eye drops. We give you the necessary eye drops. If you have money to buy, you buy those necessary eye drops and go. Welcome to my life. Please like, subscribe, and share. Thank you. Welcome. What is a good eye pressure if you have glaucoma? What is a good eye pressure if you have glaucoma? I've always told you, normally you are supposed to have your pressure between 10 and 18. But sometimes you can say 10, 20, but some people take 8 to 16. But if you are between 10, sorry, you are between 10 and 20, you are okay. You are jamming. If you are between 10 and 20, you are okay. How do you naturally decrease glaucoma? You decrease glaucoma by eating uh, fruits. It is best to eat plenty of fruits and vegetables. Okay, eat especially those that are rich in vitamin A and vitamin C. If you eat those things, carotenes and these green leafy plants, carrots, if you eat a lot of carrots and the rest, it can help you. And then there's a question here, they say, what vitamin fights glaucoma? Vitamin A. Based on that, but we find a vitamin A fights glaucoma and it can play a protective role. So what are the things that you can see in vitamin? You can see vitamin A. You have cod liver oil combined with vitamin A and omega-3 fatty acids should be more effective than single supplement from formulations. Is watching TV bad if you have glaucoma? This is what many patients always ask. You might be concerned about the impact to this screen time as high sight, particularly if you have a diagnosed disease like glaucoma or dry eyes. Yes, sometimes you can keep. Fortunately, neither condition should stop you from enjoying any screen-based activities. They say no, you must enjoy your TV, watch your TV, but always try to. You can close your eyes for some time and then you open again to avoid your eyes from being dry. Now they say, at what time of the day is the eye pressure high? They say it's highest during sleeping hours in the night. During sleeping hours, that's when the eye pressure is high. And then what is the average age of glaucoma patients? As I already told you, when you are over 40, you are at risk. So that's the age where we always see, we almost often see patients with glaucoma. What is the root of glaucoma? They say glaucoma develops when the optic nerve becomes damaged. The nerve that supplies the back part of the eye when it's damaged. As this nerve gradually gets worse, blind spots develop in your vision. For reasons that doctors don't fully understand, this nerve damage is usually related to increased eye pressure. Okay. What is this a silent thief of the eye? We say is glaucoma. Okay. They say what can worsen glaucoma? The things that can worsen glaucoma. If you are a drunkard, if you are a smoker, just know you are in trouble. How fast does glaucoma worsen? It means that when glaucoma takes your eye, how does it damage your eye? It goes from 10 to 15 years and becomes, it normally takes from 10 to 15 years. Okay. How common is glaucoma? How common? We have not even said that one. How common is glaucoma? At the current time, there are about 80 million people worldwide with glaucoma. God forbid. Say you should not be one. Go and check your eyes. Most interesting, about half of the people who have glaucoma don't even know. My London. Those people who have glaucoma, they don't even know. Think about that. In the United States, we have more than 3 million Americans who have glaucoma, and about half do not even know. Can you imagine that you have glaucoma, you don't know? My God. 80 million people in the whole world have glaucoma. What vision is lost first in glaucoma? Peripheral vision. This vision. When you keep your hands like this and you cannot see your hands, rush to the hospital. You're having glaucoma. When you sit like this, you keep your hands, I'm keeping my own. And you cannot see your hands, rush to the hospital. You have glaucoma. Can you live 40 years with glaucoma? Yes. Glaucoma can ruin and destroy life. The average life expectancy of people with chronic open glaucoma is approximately 12.8 years. So the number of glaucoma cases in 2021 was approximately 80 million, and the projection for 2040 is almost going to 111 million, means it's increasing. Can you get your vision back after glaucoma? No. No, it's irreversible. You cannot get their vision back. Why treatment for glaucoma cannot restore vision if already lost? Now you cannot get it. It can never be restored. It can preserve the remaining vision. We can preserve the remaining vision, but we cannot reverse the vision. Can smartphones cause glaucoma? No. They say, while there are various factors that can influence eye pressure, research suggests that prolonged smartphone use may contribute. Okay. Prolonged smartphone use may contribute to glaucoma. Do your eyes get tired with glaucoma? The first signs of glaucoma often sort and may include gradual loss of vision, means the vision is going down, gradual loss of peripheral vision, means you are sitting like this, maybe you keep your hands like this before you see it. Difficult seeing in low lights, or increased eye fatigue, when your eyes are really tired. Know that you can have glaucoma. Can I watch TV if I have glaucoma? Yes, you can watch TV. Having glaucoma doesn't mean you have to give up watching your favorite television shows. It just means that you can watch them differently. Don't take the whole of your time watching TV. You shouldn't be over watching TV. Can you avoid going blind with glaucoma? Yes, it can avoid it. Glaucoma does not have to lead to blindness. It is important that you see your eye doctor when you notice any changes. Yes, we can avoid it. When you already have glaucoma, you come to the hospital, they can give you eye drops. We should be controlling through eye out. We can give you we can do laser. We can do laser treatment on your eye, or we can do surgery on that eye so that you will not go blind. So what is the end stage of glaucoma? The end stage of glaucoma is severe damage to the optic nerve, severe vision loss. Severe optic nerve damage leaves only a small area of the central vision. On my video, I'm going to upload a video this evening. I will show you irreversible blindness from glaucoma. A small 25 years old boy. I will show you watch my vision. What causes glaucoma to come on suddenly? Close angle occurs. Okay, when there is something they call a close angle, that one can come suddenly. When the fluid in your eye cannot flow, that one you feel pain, something else. How can I tell? How can I tell if my glaucoma is getting worse? Seeing rainbow colors, just know that it's a problem. When the vision comes and goes, you see like this, you see something, you don't see again. Eye pain or discomfort, that can cause it. What age does glaucoma usually start? People, we said it starts from 40. So if you have from 40, go and screen your eyes. But people over age 60 are the greatest risk. Even though I say go and start from 40. If that happy birthday to you, things go and do your eye vision. What could be mistaken for glaucoma? What could be mistaken for glaucoma? So sometimes some people even mistaken cataract for glaucoma. Some people mature cataracts on both eyes, the patient is blind, can mistake it for glaucoma. What habits worsen glaucoma? Again, I say what habits worsen glaucoma? I'll keep repeating it. When you're a smoker, stop smoking. Drunkard, stop drinking. Just stop you eat. You will go blind. You will worsen glaucoma if you have it. What is the best thing you can do to stop glaucoma from getting worse? What's the best thing? Eat healthy diet. Limit things like caffeine. Go to the hospital for checkup. Eat healthy things, go to the hospital. Which medications worsen glaucoma? As we said the medications that can worsen glaucoma we have. There's an anticholinergic, this one. Sometimes we say, how many people with glaucoma go blind? They say 15% to 20% of patients with glaucoma go blind. Mhm. Does glaucoma shorten lifespan? When you are blind, you know your lifespan is shortened. If you are blind, you know you are. For me, they say glaucoma is not a life-threatening condition, but if you are blind, some people say glaucoma is not a life-threatening condition. When you are blind, you are not able to see your children. If you have children, you are not able to read your Bible. You are not able to do other things. It can even lead to depression, and sometimes you die. So we should not think that if you are blind from glaucoma, sometimes you are blind from glaucoma. You force someone. There are some patients that are blind and then they force someone, they hit their head and they die. We cannot say it's glaucoma that killed you. It's accident that killed you, but from glaucoma. What is the normal eye pressure? We've said it. Our normal eye pressure 10 to 20. What is the best sleeping position for glaucoma? Sleeping in an upright position. The way I'm sitting like this. Sometimes when you sleep like this, it's good. It helps you. What is the best eye vitamin for glaucoma? They say vitamin B. So most of the times when the patient comes to the hospital, when you are prescribing your glaucoma eye drops, add vitamin B complex for the patients. How to reverse glaucoma damage? Glaucoma damage can never be reversed. If a patient comes to the hospital and is 50% damaged, maintain that 50% vision, not to go down to 40. But you can never make that vision to go up to 60%. Mm-mm. It cannot. It cannot. There's a question here. There's the question here. They say, can you live with glaucoma without going blind? No, you go blind. As we already said, if you are with glaucoma, between 15 to 20 years, you will go blind without treating your eyes. What are the early signs of glaucoma? Your vision is suddenly blurry. You have severe eye pain in some cases. You can have headache in some cases. You feel sick or stomach, and that one is sudden loss of vision from glaucoma. What foods trigger glaucoma? They say high fats. Foods rich in fats, they trigger glaucoma. What infection causes glaucoma? Herpes virus is prevalent in, but it can lead to glaucoma. So, thank you, thank you very much. Thank you very much. So, this is glaucoma week. You have to go and check your eyes. Go to the nearest hospital, eye department, and check your eyes. This is glaucoma week. Go to the nearest eye department and check your eyes. Go to the nearest eye department and check your eyes. Even if you are an eye worker, check your eyes. Take the advantages of checking your own eyes this week. Thank you very much. Bye bye.